I think the meeting with Eileen Munro in Queensland with, the round table and subsequent meetings with people in the sector and in the government was a real opportunity for us to refocus and look at what is the system that we've created since the CMC and who does it serve the best. From my point of view, it was really refreshing to hear Eileen Munro and subsequently to see the Munro report focus on the need to support families earlier, to make sure that parents, as the primary carers of children, have a say in the system that is valued and heard, and that particularly when parents feel that they aren't being listened to and that it is in the interests of the child for them to maintain a relationship with their children, that there be more formal processes whereby parents can be heard and their issues acted upon, because ultimately it is always in the best interest of the child to know either why they can't be living with their family or to live with their family if at all possible. I think it's really important at this point of time in Queensland that we focus on how do we develop a system that has the combination of prevention and early intervention services, well-resourced secondary services and tertiary services working together. That means that the non-government sector needs to work in partnership with universal services at the prevention and early intervention end, and with child protection services at the tertiary end. But in the middle, there are all those services for domestic violence, homelessness, mental health, substance abuse, where people are going to community agencies every day because they trust and value them and want to seek the support they need to make a difference in their lives and the lives of their children. The system needs to value that more, and we need stronger alliances between NGO services, whether they're funded at a neighbourhood centre level, early intervention services, or specific population groups like homelessness, domestic violence. Young parents are critical, and I think we really need to stop judging people because they're in care themselves and give them the best opportunity to try and make their relationship with their children work if possible, because at the moment the group of parents who feel very discriminated against are parents who were in care themselves as children. And I think that we've learnt a lot of lessons from the Ford inquiry, the CMC, about the impact and identity issues for children of being removed from their family and not understanding the reasons why, and not understanding why services couldn't have been provided to support their families, because many times it isn't, their files don't reveal that they were abused by their family, they reveal that they didn't have the income or a job, or they was people that a family member had a mental illness, or some crisis occurred in their family which prevented the family from staying together. So it's important that we get the balance between the right of services, the range of services we need for people living in poverty, people where neglect may be an issue, and those where there is serious abuse and harm, which of course means that children need alternative care.